Yeah, yeah. Got it kind of late.
I do have a couple more. I know. And yeah, that's just from 2020. Right, right. That's what I catch up. That's the last report. Good morning.
All right, I guess we'll go ahead. Oh, with your outfit, huh? Tim don't miss nothing, do he? Yeah, oh, it is. It's just gorgeous. I could not believe that. I put on something in between. I could have put some summer stuff on.
Yeah, I know.
Yeah. Okay. Yeah. Good morning. Health and Human Service will come to order. Madam Clerk, will you call the roll, please?
Commissioner Baker McCormick, Commissioner Marecki, Commissioner Anderson,
He's on his way.
Commissioner Colleen, Chair Scott,
Present.
you have a quorum present.
Thank you. And we will move on because we've got a full agenda. Okay, next item.
B, Chairwoman's remarks.
Uh, I have none. Thank you.
C, approval of the August 26, 2025 meeting minutes, and we can use our tablets.
Okay. Why did you tell me I had to do that?
Need a motion?
Oh, this, yeah. Okay, moved by Commissioner Marecki, supported by Commissioner Tim Khalid. All in favor? Yes. Tried to.
Motion carried.
Thank you. Okay, next item, please.
D, unfinished business. There is none listed.
Next item.
Moving to item 1 under new business, requesting commission approval of amendment 1 to a comparable source professional services contract with 2 one-year options to renew with Vision to Learn to modify the invoicing and funding structure for its mobile clinic.
Okay, is there anyone here? All right, here she is.
Good morning.
Good morning.
I feel like we often have to say good afternoon to you all.
Yes, well, thank you for being able to come this morning.
Of course. Aja Harris Martin, Chief Program Officer, Health Human Veteran Services. So with recent federal changes, how a lot of the grants that Vision to Learn received to match our contribution to this program, the indirect, direct percentages have changed. So in order to make sure that they are able to be paid for the full visit, we're kind of changing how we're paying them as well. So the amount is not changing. At first, we were paying like a visit for a visit. Now we basically are paying for more of the indirect expenses so that they can receive the full payment for the services.
Okay, if community like Highland Park, I understand they had 130 and they used 112, would they be able to continue if they need more?
Yep. So we have Highland Park. We're revisiting Highland Park next year.
Oh, okay. All right. Thank you. Anyone else? Commissioner Kleen?
Madam Chair. I missed what you said right at the beginning about their funding source.
So part of the reason we were able to get comparable source with this contract was because we were contributing as a county 1.5 million, and Vision to Learn also raised 1.5 million for the contract. So the total amount of services to service kind of the Wayne County school districts that we selected is $3 million. And some of the federal money, some of that 1.5 million that they got was federal grants, and just the federal granting direct, indirect rates have
But
changed.
they haven't lost any federal
No,
grants.
they haven't lost it. It's just the indirect, direct have changed, like the percentages that they'll allow for the indirect.
And what do you mean selected districts?
So we chose kind of districts of high need. That was kind of the priority for this contract. So I think in total, What we kind of call them is district geographies, because a district, one city or municipality can have like 6 districts if you have charter schools, private schools, et cetera. So we try to do district geographies and go into areas of most high need around Wayne County.
And how is that determined?
Based upon childhood poverty rates, based upon federal free lunch program rates.
Okay, and roughly how many pairs of glasses do we get out to people?
So last year we were able to get nearly 4,000 glasses out. We got 3,700, and that was with us starting in October, starting to schedule schools in October. So that was a huge success. We've already started scheduling schools for this school year, and so they're ready to kick off toward the end of September.
So we're going to put these glasses on young people.
Mhm.
They're going to lose them. They're going to break them. Are we able to replace for families?
Yes, so every pair of glasses that a student gets, if they're a part of the Vision to Learn program, they can call Vision to Learn and get one replacement for free.
Thank you. Thank you, Madam Chair.
Thank you. Commissioner Marecki.
Thank you, Madam Chair. So I read somewhere, because we had a lot of information on this, and I don't know if it's this year's goal to do 10,000 eye exams total and give out 7,500 pair of glasses.
That probably is this year's goal.
So is it like 3/4 of the kids need glasses?
So what we've actually been finding everywhere else, because Vision to Learn obviously isn't just a Michigan-based company, they're a nationwide partner. Most of their other cities and municipalities and states that they've worked with, they've seen around 30 to 40% of those who are screened need glasses. Us in Michigan, what we've actually seen with our rates are closer to 50 to 60% of the children need glasses.
Wow.
Yeah.
That's pretty shocking.
Yeah.
So, and then they talked about, excuse me, that they go into non-mandated grades and some are going into mandated and non-mandated.
Yes.
So what
So-
is that?
So we, the public health are as Wayne County, here in the Vision team, we partner closely with Vision to Learn. How Vision to Learn has worked and operated in some other areas is that they do everyone in a very small scale. For us to expand the reach of our program, we're partnering with our Vision and Hearing team. So Vision and Hearing has mandated grades and Vision to Learn. So that might mean that we go to a school and we screen every other grade. But a part of this program, because we want to make sure that we service the school, Vision to Learn will come in behind our Vision and Hearing team to service the non-mandated, screen the non-mandated, so that they can do eye exams for the entire school.
Okay. And then you talked about the free lunch, and I don't even know what's happening with the budget in Lansing, but everybody gets free lunch now. So do you still have the
Well, there's still
statistics?
rates, yeah. So we still have the statistics based upon like the previous federal free lunch program. Like those rates are different
have
than
that.
kind of state. Everybody gets it.
All right, thank you.
Everyone is still going to get free lunches this
No, I am not sure. I
Well, I
don't know,
think they
but
decided
yeah,
that-
the state decide like the federal free lunch program is different from how Michigan is
Okay.
rolling out free.
We'll see in the new budget.
Yeah,
Okay.
it's supposed to, I think by
We
the
don't
end of the
know.
month, they're supposed to let the schools know. They're all getting it now.
Okay.
I'm moving for approval, Madam Chair.
Yep, support.
Moved by Commissioner Chelline, supported by Commissioner Marecki. And I vote yes. All in favor?
Motion carried.
Yes.
Administration would like to take the appointment.
Yes. Mhm. All right. We're gonna go out of sequence for a moment. We will do item number 12 next.
Item 12,
Mhm.
requesting commission approval of the appointment of Rachel Davis to the position of Director of the Department of Juvenile and Youth Services.
Good morning, Brian Reinhardt, Chief of Staff to Wayne County Executive Warren Evans.
Good morning.
Good morning, Rachel Davis, Assistant County Executive.
Good morning. Welcome aboard.
Thank you.
All right. This is for an appointment. Does anyone have any questions?
Maybe they could just talk about it.
Okay.
Or just go
All
for it.
right.
Yeah, so we're asking for approval of appointment of Ms. Davis. Morning, Commissioner. To the position of Director of Department of Juvenile and Youth Services. Ms. Davis has 24 years of dedicated service to Wayne County. She joined as an entry-level employee with the Wayne County Sheriff's Office, worked her way up to the rank of captain, transitioned from the Sheriff's Office to our office, where she is an Assistant County Executive, and now this vacancy is an important role for us. And so we're sort of looking to make another move, although we're very, very pleased with having Ms. Davis upstairs on 31. She's been a tremendous asset to our office and has really, really closed the loop on a lot of open-ended projects and things like that. So bittersweet. However, we are asking for your confirmation. Just a few things about Rachel that I could share. As I talked about her path through the sheriff's office, and also I can speak to Rachel's character over 24 years. It doesn't matter what the project is. If it's been given, Rachel has learned from it, grown from it, and just exceeded expectations. One example I can point to: when you're an entry-level deputy hiring out in a jail, and then years later you're asked to represent a stakeholder in building an entire criminal justice complex. Rachel dedicated 5 years of her career to making that CJC happen. And that's just not something an entry-level police officer generally would do, right? There's expertise there. And she rose to the occasion, did a wonderful job, and we're very proud of that. So that's something I can point to that, again, was a challenge. She rose to the occasion. And Rachel has a strong support system from us. As you know, a couple of years ago, I was appointed czar by the county executive in 2023 over the JDF. And so I will continue to work with Rachel on all the knowledge that I have to make sure she's successful, if so appointed by this honorable body. I can tell you that Brian Manning, Assistant County Executive, is also in the room, and he'll bring his couple decades plus of experience in this space to support Rachel as well as our entire cabinet.
Thank you.
I could go on about her hero statement, but I'll stop there unless you have questions.
Right. Okay, Rachel, would you like to say something?
Yes, I would just like to thank the county executive for supporting me in this role. And I look forward to working with all of the stakeholders that we have been dealing with in JYS, and just have a continuity of service so that there's no misstep for the youth that we serve.
All right. Thank you so much.
Thank you.
Any questions of either one of them? Commissioner Killeen?
Thank you, Madam Chair. Good morning, Ms. Davis. You've been around the county a while.
Yep.
This isn't new to you at all. So can you name a couple of your priorities coming in? We've had some things go on in juvenile. What are your priorities coming into the job?
My foremost priority is to maintain a sense of continuity. When leadership changes, that kind of can impact the culture, and it can impact the projects that are being worked on. So that's one of my major focuses, is to just maintain continuity with all of the partners who have been helpful with the JYS department.
Any new initiatives or areas where we've had difficulty that are priorities for you? Continuity just means we're just going to keep doing what we've been doing. But it seems to call out for some new initiatives over there. So what do you see as the issues you want to attack?
There are several issues. There's gun violence right now going on in the youth community. We are working with external
I mean,
stakeholders.
within the confines of the JDF.
Oh,
yeah.
within confines of the JDF. We're working on several different programs. We have behavior management programs for the youth. We have ongoing staff and leadership training for the personnel that work at the JDF. That way they can, be of best service to the youth that are there.
I wish you luck.
Thank
That's
you.
a little bit of a meat grinder over there, if history tells us anything. So good luck. Thank you, Madam Chair.
All right, thank you.
Yeah.
All right.
Yeah,
Commissioner
good luck as well. I mean, the vote's next week, but Melissa did a lot of stuff over there and changed a lot of things. So you're going into, I think, a good place. I mean, I'm sure there's always improvements, like Commissioner Killeen was talking about, but yeah, there were a lot of programs put into place, and we've heard from the behavior management people, and with the staffing, so that's it seems like a good thing to continue. So good luck.
Thank you.
Okay. Commissioner Anderson? Oh, okay. And let it be known that Commissioner Anderson has come in.
Duly noted.
Okay, thank you. All right, moved by Commissioner Anderson,
Supported by Commissioner Marecki.
supported by Commissioner Maraki. All in favor?
Please vote using your tablets. Motion carried.
All right, thank you.
Thank you.
Thank you so much. We look forward to working with you. Continue to work with you.
Thank you.
Thank you.
Moving back up to item 2 on the agenda, requesting commission approval of a 3-year use and occupancy agreement with 2 one-year options to renew with Garden City School District to use space at the Community Services Center for Alternative Education to operate the Women, Infants, and Children Nutritional Program.
Good morning, Commissioners.
Good morning.
Dr. Osorio, Director of Public Health Division. And this is just a request for the approval of a 3-year lease agreement that we have with Garden City to continue our services for our WIC program. So very successful partnership that we've had with them for a while. So we would just continue, and it seems to be well served. So
No new changes.
no
just-
new changes. Yes.
Anyone? All right, moved by Commission, oh, did you wish to, okay, all right. All right, moved by Commissioner Killeen and supported by
Commissioner Anderson.
Anderson. All right, all in favor? Aye.
Thank you.
Motion
Okay,
carried.
motion carried. Okay, next item, please.
Item 3, requesting commission approval of Amendment 2 to a 3-year contract with 1 2-year option to renew with Downriver Community Conference to allow time to prepare contracts once the evaluation phase is completed and to continue providing prevention/early intervention services for youth residing in the Downriver area.
All right, go ahead.
Good morning to this honorable board. Nathaniel McQueen, Chief Program Officer for Juvenile Youth Services, Wayne County.
Portia Carlisle, Division Director of our Community-Based Programming.
All right, thank you. You wanna,
Yes, so what we're asking for is a 3-month extension to carry us to December 31st of 2025. That will allow us the time needed to prepare for our new youth assisted program, our YAPs that are coming on board starting January 2026.
any questions? Commissioner Marecki?
Do we, this is 3-month extension. Do we know who's coming on board? And
Yes, so our review board has done the reviews of those proposals that have been presented to us after the RFP went out. We have concluded that and sent that back over to procurement. And so at this time now, procurement is now working to make sure that everything comes into fruition with our budget that we have allotted for our youth assistant programs.
okay,
So we anticipate in about 3 months here, about 90 more days, we'll have that all rectified and be able to start those new YAP programs January 1, 2026.
okay, so this is just an
Commissioner.
extension for all of these.
Correct.
No, and, oh,
Go ahead.
I finished.
No, I'm set. Yeah, we could put them all, that's what I was gonna suggest, maybe putting
Yeah,
them all
we'll just
together.
Take them all together. Mhm. Commissioner Anderson.
Just wondered if we have any returning or continuation of contracts, or the ones that are going to be proposed, or are they most of them going to be the ones that have provided?
Yes, so once the
service?
RFP went out, obviously everyone had that opportunity then to present proposals to us. We did have some that we currently already have that submitted proposals, as well as new additional ones that submitted proposals.
Mhm. Okay,
Okay.
thank you.
All right, well, Commissioner Killeen.
Thank you, Madam Chair. Because we have, including this one, in the paperwork, it says youth assistant services for this. Is that also YAP?
Yes.
Okay, any reason why we call it something different? Because we're going through the downriver community conference, they provide the services, or they,
That's correct. They do provide
Okay.
that service right there.
are you able to speak to the other youth assistant programs that are on our agenda today?
Yes, each one is the same. We are asking for a 3-month extension on each one
Yeah,
that we
so
currently.
I wanted you to make sure you did and expound on that a little bit. We're gonna take a 3-month
Yeah,
why?
well, we did put the RFP out, we did get those proposals back, and then we did submit that to procurement. There is some, how would I say it? Positioning because of the amount of funding that we have for our youth assistance program and the amount that total amount of the contracts that were looked through and approved to be able to move forward with, there's a difference in the funding. And so now procurement will work with those particular individuals to see if we can make sure that we come within our budget, because we do have a budget that we have to maintain. And so there were a double-digit number of youth assistance programs, which increases what we currently have, which we were definitely looking to do under previous and current new leadership. We wanted to make sure we increase that scope to be able to reach as many young people as we possibly can. And so we still want to do that, but we still have to make sure we stay, fiscally responsible and stay within budget. And so right now procurement is working to make sure we stay within that budget. And so we anticipate within the next 90 days, we'll be able to have that rectified and make sure we stay within budget while increasing our number of YAPs that we have.
And when was the last time a report on these programs? Is this all of them, 7 that we're looking at today?
Because that's what we currently have. Yes, we currently have 7 of
okay.
them that are in place, and we're looking to extend each of them 30.
And when
30
was the last
or
time
90
the
days.
commission has seen like an annual report or whatever on YAP? Seems like it's been a while.
It'd be November. Every November it comes out, if I'm not mistaken. Each November of each year, each fiscal year.
So we got one last
year, 2024, in November.
It's almost a year ago.
Yeah.
In preparing for 3 months from now, where we might have some contracts, can you share that? Because this year's report won't be ready, will it?
November of this year will come out because we're in September now.
October, November. So we will get it probably before these are
60 days
renewed.
before, correct.
Okay. Because I wanted to see that before I start the voting thing.
Understood, sir.
Yeah. Okay, I'll wait on that report. Thank you. Thank you,
Okay.
Madam Chair.
All right, thank you. Commissioner Anderson?
Thank you, Madam Chair. Just a quick question. The youth assistance program for the city of Westland, I do see it here. Okay. So it's in what we're voting on today.
It's one of them, yeah.
One of them. Okay. Yeah, I see now. Thank you.
All right, thank you. Any questions on any of the others? Okay. Hearing none.
Madam Chair,
Yes.
I'll move items 3 through 10 if I've done this correctly.
Correct.
Staff can tell me no,
Correct.
Commissioner, you messed it up.
That's correct.
That's correct. 3 through 10. I'll move for approval.
All right. To move by Commissioner Colleen, supported by Commissioner Anderson. And all in favor of Commissioner Marek?
And Madam Clerk, I'd like to abstain on number 6.
Thought you might.
Yeah.
Duly noted.
All right, all right. Thank you. All in favor?
Motion carried.
Carried. Thank you.
Thank you.
Okay. Next item, please.
Moving to item 11. Requesting commission approval of Amendment 1 to an intergovernmental agreement with Wayne County Regional Educational Service Agency for the purpose of increasing literacy outcomes and to continue providing educational and mental health services to Wayne County students outside of the city of Detroit.
Thank you. I believe there's a person online that wants to speak on this. Oh, they're here. Okay.
Good morning, Chair Scott, and to the entire commission. Davita Colbert, Superintendent Wayne Risa. I'm also joined by Assistant Superintendent Drew McMeekin, as well as Beth Gonzalez, Deputy Superintendent. And so first, we want to say it is an honor to continue to partner and to serve our youth in Wayne County. Thank you for allowing us to enhance and expand the availability of mental health services and supports to K-12 students in Wayne County. Thank you for helping us to increase access to high quality and high interest culturally relevant student texts, which will improve literacy outcomes. Also connected as a partnership with New Zealand, as well as supporting math, transforming math and mathematics teaching across the county. With that, I'm going to turn it over to Drew, who can talk about how the dollars that were already shared have been expended. He will give us updated numbers, and then any additional questions that you may have about the findings reports that were shared with you about the 3 initiatives. We'd be more than happy to answer those questions as well. So again, thank you for allowing us and understanding why once the meeting changed, we could not come in person, but thank you again. Drew?
Good morning, Drew McMeekin. I'm the Assistant Superintendent of Financial Services for Wayne Risa.
No audio.
I
text,
am-
Everybody.
Hang on, you're gonna have to repeat everything. Yeah, maybe he's got
Hello?
the idea now.
No, Drew, I don't think they can hear us. Hold on.
They can't turn on their own mics, just like a regular Zoom.
I just turned mine on again. Can you hear me now?
Their settings.
I can hear you, Dr. Colbert.
Okay, but I believe that they can't hear us.
And to think we can still talk to Voyager 1.
Yeah, Brian sent me a text. They can't hear us.
Couple billion miles out.
I can hear you both.
Technology.
Okay, that means everybody else can hear us.
If need be, I can provide context at minimum.
Leave it up to T.
Would you try speaking again, please?
Yes, can you hear me? I can keep talking.
Yes. Can you hear me?
No, I don't think they can hear any of us. Only the people on the computer can hear us, I think. Put the slides up, Drew. Brian said put the slides up. Can you share them?
I'm trying, yeah. Are you able to see the slides?
Yes, I can.
Okay.
They said technologies just went into the room. Is that the first slide?
Yeah, I have a title slide.
Okay. Technology's in their room now. They asked us to hold on. Okay, can you hear me now? Okay, so good morning again. Chair Scott, you can hear me? Okay, now we can't hear them. Okay, okay. All right. So good morning, Davita Covert Superintendent Wayne Risa. I am here joined with Assistant Superintendent Drew McMeekin of Financial Services and Deputy Superintendent Beth Gonzalez. Hopefully you have received, well, I know that you've received the executive summaries and impact reports for the 3 projects that we are honored to have partnered with you all on. Thank you for the funding that helps us to continue to enhance and expand the availability of mental health services and supports to K-12 students in Wayne County. That allows us to increase access to high quality, high interest, culturally relevant student texts across disciplines to increase literacy outcomes, as well as to transform mathematics. So transforming mathematics achievement and supporting equitable outcomes in mathematics teaching and learning throughout the county. It has been an honor to have these 3 projects funded. Drew McMeekin will talk about the carryover that is remaining from the original allocation, as well as any questions around the impact reports for the funded projects that have been shared. Beth Gonzalez can share that and our current data, because as you know, M-STEP scores have been released. And so we do have updated outcomes for the county. Drew?
Thank you, Dr. Colbert. Drew McMeekin, I'm the Assistant Superintendent of Financial Services here at Wayne Risa. I've prepared just a couple of slides, which I'm sharing right now, at a very high level, just to go over how we've spent the grant so far. And so on this first slide, it shows our grant spending through August 31st, 2025. On the large darker blue section shows we've expended just over $11.1 million to date, and we expect to carry over $2.3 million of the original allocation. The areas that we spent this were on the high quality texts, which was with the News Ella team, our math coaches, and our mental health supports and services throughout the county. And this pie chart shows the amount that was spent given directly to school districts. 2.6 million for the high quality texts, 4.4 million related to the math coaches, and 3.3 million for the mental health services. Our total amount that we've distributed directly to the districts is 10.4 million. We also had some additional expenditures related to the math coaches for professional development, which includes math consultants here at Wayne Risa that have helped train the district's math coaches. And then the final slide I have today is our participating schools. So who has received the money and in which category. So the lighter green on the top represents our public school academies, and then our dark blue on the bottom represents the local school districts. And so overall, in all of the categories, over 50 schools have received funding in one or more of the categories, 18 public school academies, and 32 of our local school districts. And that concludes the financial presentation. Thank you.
Because I can't hear any questions, are there any questions or is there any information that you'd like us to expound upon in terms of the impact report?
All right. Is there any? Yes, she said yes. Can she hear us?
I can hear you now.
All right, thank you. All right, Commissioner Marecki.
Thank you. So when you say the impact report, and maybe I missed that in my packet, but when I think of impact report, I think of statistics showing that these programs worked. Not so much in the mental health, because that's, I know, hard to evaluate, but in the math and the reading. So did I miss that report, or is there no report on how this affected the students? Because this is a lot of money that was distributed. So that's what I'm wondering.
There was an impact report that was sent, I thought, to the commission. When we had the questions, they submitted a report with the information of how the money was spent. If you don't have that, I can get that to you.
But would that also show us how the scores were? Because I mean, every year we're reading that these students in Michigan are not doing what they're supposed to be doing. So how did this $13 million or 11, whatever it's now,
I can speak to
actually impact? So the school systems, and I don't know if every school system had this, but there was a program, I don't even know if they do it anymore. It was called Reading Recovery. And they would take a student for 12 weeks and they could show exactly the impact that made. It was an expensive program, but they would bring kids up to reading level with that program. So I'm just interested in statistics on what happened with all this money and, you know, what all these school districts, how it made a impact in it, because all we keep reading in the news and then the free press is the reading scores and the math scores are bottoms.
Yeah.
So
Yeah,
that's
thank
my
you.
question.
I welcome the opportunity to speak to this. So as Dr. Colbert lifted about 2 weeks ago, was the statewide release of MSTEP, PSAT, and SAT results. And our team has done an analysis of countywide improvement as it relates to MSTEP, PSAT, and SAT data, both including an aggregate of all districts and then also looking at specific districts. Those outcomes are not reflected in the reports that we submitted to you because they were due prior to the results being released. And then we also have some specific district level studies underway in partnership with Newsela and our districts that are using. But in broad strokes, I'll speak to aggregate performance. In English language arts, Wayne County students posted year-over-year increases in nearly every grade level. All grade levels from grade 4 through 11 improved, really signaling broad and consistent progress. 6th grade ELA proficiency jumped more than 3 points, from 28.4% in 2024 to 31.6% in 2025, respectively. To give you a little context, for every 1% increase of improvement in proficiency countywide, that equates to about 1,321 students in ELA. And so significant improvement there. 8th grade students also posted strong gains on the PSAT ELA, rising from 52.8% to 54.3%. Again, a clear sign of a momentum in the middle grades. Obviously, we know that certainly our work is not done, that those percentages are inadequate. But this initiative specifically around high interest, high quality, rich grade level text is contributing, we believe, to middle grades improvement as one of several measures. Obviously, this is one input of many, and particularly for students in districts who have high usage. We also had significant growth at grade 11. SAT performance grew more than 4 percentage points. And we are closing the gap with the state. So in third grade reading, the gap has narrowed from 12 percentage points between Wayne County's performance and statewide performance in 2022 to just 8 percentage points in 2025. And so Wayne County is improving at rates that exceed the statewide improvement. And just for context, in English language arts, Wayne County students in grades 6, 7, and 11 have outpaced their pre-pandemic performance from 2019, again, demonstrating meaningful growth and recovery. Also in mathematics, which again, we're thankful for the support of the county in providing necessary coaching supports to our educators. We're seeing growth, really evident growth across both elementary and middle grades. The coaches that you've provided are specifically for elementary. We saw increased proficiency in every grade level except 3 and 8. And those 2 grades, the state declined even more sharply. Again, meaning Wayne County is still closed the gap between our previous performance and statewide performance. 4th grade math proficiency rose nearly 2 points in 1 year. 6th grade math also improved almost by 2 points. And the most notable performance came in high school with SAT proficiency growing over 2 points. A stronger rebound, again, than the state's. Altogether, Wayne County's improvement again, I'm just reiterating the same thing. We are demonstrating accelerating momentum in mathematics achievement. And so we're feeling really positive about our progress. Obviously, all of these supports are necessary to this improvement. And in the work that we've done with our coaches, it's built on a foundation of high quality, guaranteed and viable curriculum, short-term formative assessments for students, understanding that data, providing tiered interventions, and really being very focused on what students need to progress. And that is why our district superintendents value the math initiative so greatly. So I hope I gave a response, and then we'll have additional data for you specifically to the literacy initiative with the district level case studies that are being conducted. Again, as I shared, the data that I just shared with you in terms of aggregate performance was just released. And so additional analysis is underway.
Okay, so this program started last year, right? When the 13 million was given to RISA. What grades did that target? Because the PSAT is at 9th grade and the SAT is 11th grade. So what grades for the math and reading were targeted last year with these $10 million?
Yes, so these specific initiatives for the mathematics work, it targeted grades K through 5. And for the ELA work, it targeted grades 3 through 12.
Okay, for the it was 3 through 12. So the math wouldn't have affected anybody with the PSAT and the SAT because it
That's
was
correct.
grades.
This specific initiative, I thought it would be relevant to give you an overall
Yeah, no, I
picture.
appreciate that.
Yeah.
I just want to know what this money did because it was a lot
Right.
of money. So so that wouldn't have affected those grades as far as math was concerned, as far as that testing. So the state does testing at what, 3rd grade and 8th grade?
The state does testing grades 3 through 8 and then 11.
Okay, 3 through 8.
That's correct.
Not just 3rd grade and 8th grade.
Oh no, 3rd, 4th, 5th, 6th, 7th.
Okay.
I'll
Okay.
take M-STEP and grade 8 takes PSAT and then high
Okay.
school students take SAT.
Okay,
I would
so
give you, sorry.
Oh, go ahead.
No, I was going to give you one specific example based on the K-5 math work in terms of a district. We were able to fund a K-5 math coach in Crestwood, and they're showing really strong and steady growth. So their performance in terms of Proficiency on M-STEP math was 2.5% in 2023. And after 2 years of having a math coach, they're at 7.84% in 2025. Again, not adequate, but that kind of progress, growing over 5 percentage points in 2 years, is statistically significant.
So can you give us any of this information before we vote on this? A week from Thursday?
Yes, we can provide us a written summary of the information that I have provided, with, the grades that are relative to these initiatives. Again, there's
Okay.
not a direct correlation exactly like with New ZLA and usage, but overall performance we can provide, yes.
Okay, I'd appreciate that. Thank you, Madam Chair.
Certainly.
Anyone else? Commissioner Colleen?
Yeah, thank you, Madam Chair. And I'm going to ask commission staff, in looking through the analysis here, is the kind of data she's talking about, was that submitted to us?
Chris Albrecht, policy analyst. So I was looking back through my email and it appears sometime, I want to say in August of this year, there was a presentation that RISA did, and then there were some documents that were submitted. One of them appears to be something like an impact report. I did find that word in there. It was part of some PowerPoint presentation.
And asking RISA, do we know if that report from August is the same data that you're talking about today?
So the data that's
Yes.
represented, go ahead, Dr.
No,
Colbert.
go ahead, Beth. Go ahead.
Yeah, so the data that is included in the executive summary and impact report for the funded projects were the data sets that we agreed to report on in the beginning of the project. The questions that were posed today in terms of, overall M-STEP outcomes and what I'm speaking to, those were just released. And the reports that we submitted to you were due prior to the statewide release of data. And again, happy to provide that additional information in writing.
Okay, so what you presented or what the commission got in August, the executive report, it's hard to follow what you're saying, especially when I don't have anything in front of me. You have something on that?
I believe the department presented kind of mid-year on this. We do have impact reports for the math COSA, the literacy, and mental health. And to your point about the mental health, it is crisis mental health interventions. It's more process interaction driven. But I mean, they are trending favorably, as you well know. The state is not where it wants to be in terms of achievement out of its public school districts, but a lot of our objectives too around this to Commissioner Marecki were, we just had such a learning loss gap coming out of COVID, and it feels like 100 years ago now, but this is an initiative that began in 2023. Their first full year of having this funding was really last year. So we got a good interim look at it that we felt favorable about. And not to be overlooked, the districts actually implemented it, which we really appreciate. And RISA was a very good steward and fiscal agent for these funds and helped dozens of districts opt into this. So we will update this to the extent that it's feasible to do so and get that, to you before full board. It may well be we're furnishing you the information we furnished in August. I don't know yet, but
I would ask commission staff to share that report that we got in August with the committee. And then what I'm being told is, in addition to that, some of the stats that were run by us today will be updated, and we'll have that before full board.
At bare minimum, we will recirculate to commission staff.
Well, we have the report. We can circulate it ourselves, but new data.
Okay, if we have anything new, we will definitely furnish that. We'll compare with
I think I heard that. That was the stats that were given to us today.
Yeah, she said she would summarize them
Over,
and
yeah,
send it
yeah,
Yes,
to the
we can do
commission.
that.
okay.
We can do
Um,
that. The M-STEP release was about 10 days ago, so that's why that's new information. And that's
Yeah.
what Beth just summarized. We can give you that in a summary, absolutely.
Okay.
Yes, and on page 4 of the report, you have the math trends for those grade levels from 2022 to 24, and the data I was speaking to is 2025 data, so we will add that.
Okay. The legislature took some action a year or two ago on literacy for Michigan students. I think what was that action that the state took? I thought the legislature funded, we're going to have everybody literate by a certain date and time. What was the action the state took on literacy?
Oh, I believe that we're talking about the $35. So Beth, can we talk about the section $35? And then we can speak to the action that now is in play. It has not rolled out fully, completely, the dyslexia language as well. So I believe that those are the two that you're speaking to, Member Commissioner Colleen.
Well, what was the intent of the legislature? What were they trying to solve here?
Trying to improve literacy outcomes. Definitely, there were dollars for coaches in which we have implemented, as well as just most recently, the state had a committee that has now streamed the actual curriculum of which Beth served on the actual literacy committee for the state of Michigan. Beth?
Yes, thank you. So most recently, under 35M, the state appropriated $87 million for literacy investments. One of those was investments in the districts have the option to apply for funds for Tier 1 curriculum, literacy intervention, or professional development. And our team supported our local school districts. 70% of Wayne County districts applied. And while the funding has not yet been received, $16,108,036 were awarded to Wayne County schools for these efforts. Most and many of the districts pursued funding in Tier 1 curriculum. So this is highly aligned, guaranteed, and viable curriculum and instruction materials for educators to use with their students. Additionally, funding was appropriated for 35N, which was a $10 million competitive reading excellence and advancing district innovation grant. And we had 7 Wayne County districts apply, possibly receiving $500,000 apiece. And we're waiting for information about those awards. We're anticipating that might come next week. But we have the potential of an additional $8,500,000 dispersed to districts to support those initiatives. The 35M work is primarily to support K-5 students, and 35N expands access to secondary students. Beyond that,
excuse me, ma'am, it's hard to follow all these acronyms. I'm not in Lansing every day. I don't know what, despite my previous 15-year history, in trying to comply over at Denby High School on the east side with the statewide curriculum, I got no idea what Tier 1 is. And this 35M, is that all discussed in this report we got in
no.
August? Because I need a guide. I can't handle all these acronyms and know what it means. Because we're talking about serious stuff. We know how far behind our kids are in literacy. That's a huge one for me. My 9th graders are coming into my class reading at an average 5th grade reading level, and that goes back to the early 90s. And so I'm trying to get a handle on this and the successes and what we're trying to do. So what you're saying to me is the state had this initiative around literacy, and what they offered school districts was a menu of you can have this kind of service or you can have this kind of service, and then school districts shopped off that menu to say this is what we want.
Yes, that's an accurate summary. And I understand, forgive me, I know sometimes in education our terms can be jargony.
Are you kidding me? 15 years of it.
Tier 1 refers to
Well, that's okay. Don't go into it now.
The core instruction for all students.
Yeah, but
Okay.
see, and now that have this role, and my job is to allocate dollars for public purposes, it helps greatly if I can understand um,
What I can say to
what
you
we're
is
doing
that
here.
the projects you've funded go beyond what the state is providing.
Yeah, and
There are
that's
not statewide dollars
yeah,
appropriated for the
and
projects you've
that's
funded.
one thing I've liked about this. The other thing is when you're talking about your data, you're comparing it to the statewide averages. Is that the what's the term for it? Is that your benchmark here? Is to meet the statewide? What's your benchmark for? Hey, we've been successful here.
The benchmark is to exceed statewide averages of performance, but first, our goal has been to close the gap between Wayne County's performance and the state of
Okay.
Michigan's performance, because historically we've been performing below the statewide average.
Yeah, because I
And we
wasn't.
know that, oh, sorry.
I
We know
wasn't
the
all
state
that
will improve
excited
as
with
we
what the
improve.
state did a couple of years ago, right? Because there was a big upwelling about illiteracy among students, a big, and we had marches and all of that kind of stuff. And I understand what you have to do in your business, but to me, the statewide averages are totally inadequate. So for our citizens, so to say, well, we're up close to the state averages now. I'm not all that excited that's so to me, it's reaching beyond that for every student in the state.
We agree.
But I appreciate what you're doing. I know you're filling some gaps where the state wasn't doing some funding. And but I'll be looking forward to the report from August. And then the new data that you're providing us in the next week or so. All right. Thank you. Thank you, Madam Chair.
Thank you.
Thank you. Sure. Commissioner Mareki? Mhm.
So we got that information in August, but that presentation was made to the administration by RISA. It didn't come to us, right? I don't remember ever having a meeting with RISA.
They were here.
They were?
He's gonna say.
Am I losing my mind here? I don't
No,
remember
they
this.
were here, I think, when let's see, was it for the contract, for the initial contract?
Yeah, they were here for that. Yep.
But they haven't been, since then,
Yes.
they've been providing reports.
Got it.
And we've been sending reports to the committee.
Okay, got it. I knew I wasn't like losing my mind. My last question is, this is all ARPA money, wasn't it?
Yes.
Okay, so what's going to happen when all this money goes away? As far as a follow-up, this could all go down again.
I'm so excited. This is a question I sort of have an answer to. So when we originally put together, the county executive charged us to work with RISA to come up with a portfolio of activities here that that made sense for ARPA. I mean, time limited intervention. This crisis mental health this came off of a survey that the state did. And it was absurd levels of suicidal ideation by kids in middle school. And we just wanted to get in there. Ultimately, what we didn't want to risk was kids falling through a gap as the schools were coming back into normal operations. And, when that happens and everybody's kind of just going about their work, trying to get caught up, things like that don't get addressed. So that was one of the things. The state actually funds that now through at least right now, as we know it. One of the things we wanted to do was kind of pick things that were kind of points of advocacy for that the state would take care of. Now, on the literacy front, it sounds like there was at least some partial, step in at a policy level from the legislature to help fund some of that. Is it fully adequate? Well, I don't think any of us are thrilled with the proficiency levels in the schools right now. So we will see. Hopefully it's a step in the right direction. So 2 of the 3 initiatives we've seen the state legislature step in. The third, the math COSAs, a coach on special assignment. much like we had a fall off and a great retirement here at the county that hit hard in the juvenile detention facility, the sheriff's department, and certain other pockets of the county, math teachers and, you know, and teachers generally just fell off. We had a lot of brand new green teachers doing math in elementary schools. This was something that RISA identified. Like, okay, this coaching model sounds great. Let's kind of back up, get everybody, you know, coached up, if you will, and kind of improve, you know, the training and acumen of a new workforce that was kind of working with kids in ways they hadn't before. So to that end, that one was time boxed and the other two, the legislature stepped in on. So to that end, we wanted to get in and get out. And Dr. Colbert can probably give a more forensic explanation of that. But we knew we don't have the resources to stay in that forever. But we wanted to make a sizable time limited investment. And we'll get you the additional impact information on this. This is trending the right way. I mean, we've seen 22, 3, 4. We've seen step ups in math proficiency. It's reported in absolute terms. You'll see what percentage of Wayne County kids are, and then compared to the state, if only for reference. So, but all right.
Okay.
That was a longer answer than you wanted, Commissioner Markey, but I'd like to see. Yeah.
Thank you. Anyone else?
Moving for approval, Madam Chair.
All right. Moved by Commissioner Kleen, and supported by Commissioner Marecki. All in favor?
Please vote using your tablets.
Okay, on the tablet.
Motion carried.
All right, thank you.
Thank you.
Next item, please.
Moving to the addenda, item 13. Requesting commission approval of a sub-recipient agreement with the 2-year option to renew with Wayne County Healthy Communities to implement the kindergarten oral health assessment program.
Good morning, Dr. Sheth, Chief Medical Officer and Division Director of Clinical Care Services, this is HHVS. And I'm joined by, I'll let Javar introduce
Good
himself.
morning, Javar Jackson, CEO of Wayne County Healthy Communities, and we have another person on the line.
Thank you. Go ahead.
And we are here to request commission approval of a retroactive agreement with our Wayne County Healthy Communities to implement the kindergarten oral health assessment program. The agreement is retroactive because we received notice of the funds from MDHHS not until about April, May 2025. And the effective date on that agreement with the state was January 1st. And so they are very keen on us doing the planning and development work. So we're ready to go for the school year that is upcoming to help screen these kindergartners that are entering into school during the fall. And so it was important for us to put the effective date January 1st. So some of the planning and development work that the FQHC has been doing can be possible. We are working with Wayne County Healthy Communities because of their existing strong relationship with U of D dental program and their existing integrated dental services. And I'll pass it on to Javar to talk a little bit more about that.
Sure. Thank you, Javar. Again, now that my speaker's on, I can speak loudly. Javar, Wayne County Healthy Communities. We have been embedded in the Hamtramck and Wayne communities since 2013, and we've been providing comprehensive healthcare services to those communities, including dental services with the collaboration of U of D Dental. This particular role that we'll be working on is to provide the required oral health screenings inside of the schools within Wayne communities. And we'll be partnering with a dental hygienist to provide those services within the schools. The goal is once those students receive the required screenings, that we will be give them the opportunity to receive the wraparound services, such as if they need a higher sense of oral care, whether that is at the health center or if we use a mobile unit in the future. And as to Dr. Sheff's point, we've been doing some planning since January. And so the plan is once commission does approve this, we'll be able to then spend down on the funds for the time spent since January getting this work done. We have not started in the schools yet. Partly because we're still collaborating with the school districts to get the scheduling so we can start to do those oral health assessments, which those oral health assessments don't have a dedicated time outside. They have to be done before the end of the school year. And so we'll be ramping up shortly after this.
Thank you. Any questions? Commissioner Killeen.
Thank you, Madam Chair. Huge issue out there. I remember probably a decade ago, somebody that worked in the juvenile detention facility said to me, it was doing dental work. He was like, 15, 17 years old, and this is the first time anybody's ever looked in their mouth. So a couple of things about this. Do you have data on that? I know here we're dealing with kindergarten and first grade. Do we have any idea, like, what percent of our population, particular population we're dealing with here, just never sees a dentist?
Yeah, so we don't have that exact data, but
Yeah.
I think to your point, I mean, we know that there's significant gaps in children and adults, especially those on Medicaid and lower income families in accessing dental care. And so, we know this is not going to solve the problem, but hopefully we'll be kind of chipping away and really focusing on our families that have really access barriers to dental services to really link them to care, because assessment is an assessment. It's a screening.
Right. When you say link, because that's my next thing, you say link them to care.
Mhm.
Do they get a couple of phone numbers and good luck, or what does that mean?
Good question. No, so once the student screams at normal, they will receive a document that goes with their parent that also allows for them to have the resource to obviously use whatever dental care provider they would like to. But they also have the resource of the FQHC readily available for them. And so prioritizing those, as to Dr. Sheff's point, those communities that have access challenges, those that may not have transportation to get to dental services.
Absolutely.
We will be able to be a safety net for those patients. The uniqueness of this role is that we'll have a dental hygienist doing the work of the assessment. And so they will have a firsthand knowledge of those students' oral health needs, including whatever escalated care may need to be provided for them. So there's, again, you have first choice to go wherever you desire to go, but the FQHC will be a relevant resource readily available for them.
Yeah, because when we talk about the dearth of primary care physicians in poor communities, because they don't want they don't want everybody that they serve to be on Medicaid. They need the full. So we don't have a lot of primary care physicians in a lot of our challenged neighborhoods. And of course, to me, dentistry is part of that primary challenge. And I know we have next to no dentists around anymore, right? I could name them. I knew where they were 30, 40 years ago on the east side. Now I don't see any over there. So when we test these kindergarten and first graders, what percentage of those just have, at that age, have really bad oral care and issues?
Well, that can vary depending on school district, also socioeconomic status. I know we don't really get all into the social determinants of health.
Well, that's what I'm talking about, social determinants. That.
Yeah, so what I would add is that this program specifically, so you may remember the actual grant came before you for approval prior to this, and this is other reason why we are at this point with this contract following the approval of the funds. but the grant program is in its first year or two because of a rule at the state level that is requiring oral health screenings for kindergartners entering school.
Yeah, I heard you say required screening.
Yeah, so
When the heck did that happen?
it is a recent rule change at the state level. And so, you know, to your point, we don't really have the data because these screenings were not really happening. And so whoever had access to dental care, who had families that were able to, you know, make those dental appointments, we know there's huge gaps in that. Those are really the only kids that were getting dental care, right? Because there weren't really these screenings happening at a community level.
Yeah, let me take a wild guess here. The state mandated screenings and provided zero funds to make that happen. Is my guess accurate?
Yeah, so there is a requirement for families to have their children do these kindergarten oral screenings. They put some funding towards it, but it is, to your point, you know, our total grant award is around $200,000 for a city of, you know, a jurisdiction of our size in Wayne County. So it is really not funding towards the full population intervention. So we're really trying to focus, and Javarna's team are really trying to focus on those schools that really have families that have limited access. Though it is available for all Wayne County families, there'll be focused efforts because of our resources. And the state understands that.
So even though it's a required screening, sounds like with the funding that's available, a very small percentage of students are actually getting the screening.
Yeah, and so we will be just another access point, right? And so there'll be families that do see dental providers that hopefully will maybe able to get screenings through their other providers that they see. And we hope to be just that additional access point for families.
That gives me a picture. Thank you. Thank you, Madam Chair.
Thank you, Commissioner Anderson. I'm sorry.
Thank you, Madam Chair. I just wanted to ask, which communities do you think you'll be serving? Or not communities, but school districts?
Right now, we've had a large amount of requests in the Hamtramck School District, as well as Plymouth Canton School Districts as well. While I think because we are a new access point, once the state provided the language that we were available, parents started to outreach. And so while we wanted to prioritize some of the more distressed communities, Plymouth Canton has had a large volume of requests. And so that's been added to the scope of where we'll be going. The other is Harper Woods is another area of focus.
I'm sort of surprised at Plymouth Canton that it's certainly different economically.
Well, again, the state requires all the schools to do the kindergarten oral health assessments. So regardless of their status, it's required from K to 2. And so once that, obviously with the Plymouth Canton School District, once there was word that there was a service provider, we had some parents, I would say total tally right now, we've had over 75 requests just from Plymouth Canton alone, from parents. So we can't leave them out of the equation because of the demand that is there.
And there'll be some proactive work reaching out to schools once we are fully in place and running. And really the goal is to do these in a way where you can do many kids at one time. So through school events and fairs and things like that, where you can where you can push your limited resources more farther, right? And so we'll try to do these kind of organized events where we can reach more kids at one time.
Good. Because I would certainly think that there would be students in Inkster. Most of them are now in Wayne Westland School District because they don't have a school district any longer. But I would think there'd be a great need there, possibly even in some parts of Dearborn. And so anyway, thanks for the question, our answer. Thank you.
Thank you, Commissioner Moretti.
Thank you, Madam Chair. So does it stand now that everybody coming into first grade has to show someone their evaluation of their kids' teeth?
So it's, if you may remember or just aware that there's this health form that kindergartners, that the parents have to submit for kindergarten entry. There's other things on it.
Yeah.
And then there's the oral health screening section of that is completed by the
dentist or
the dental hygienist or dental specialist. And that gets incorporated in the form. So what I say is that no, this, at least the dental screening part, it's at the state understands that families will have challenges, right? And so every effort is made to try to encourage the kids to get their screenings as part of their, routine, checkups and other things that they're doing, but it's not being held against them for school entry.
Okay.
Yeah.
Okay. Well, that makes me feel better.
Yeah.
Okay. So, we've talked about today about the eyeglasses, getting the eyes checked, getting the teeth checked. All at the same time, we're trying to get reading scores up and math scores up, and we're, taking that time out. So do you think you will be doing a lot of the fair type thing where this would be after school? So it's not impacting their learning. And I don't know how long these take. I don't know, but all these programs seem to creep in, not just this, but there's a lot of other programs that come in that I think, frankly, take away from the reading, writing, and, the basic stuff that I see in my school district. So, what are your thoughts on that? You're going to do both things, go into the school and the outside activities possibly?
Yeah, so with reading with the school superintendents and some of the leadership, reducing the amount of student seat time issues is very important. And so there's recess room, there's certain opportunities within the actual time where we can do a 3-minute screening for those students. So there will be a combination of, while we're in school, partnering with the school leadership to identify schedules for those students, but also outreach events.
Okay. And do the parents have the option of opting out? Will they know about this before the kids will have an oral exam? Will they be notified?
Yes, so the form allows for the parents to choose whether to use the service that the school has identified, or they can do it privately if they choose to go to, again, their dentist or another type of service. But it's still required by the end of the school year that it be done. It just doesn't have to be done by the specific service that we provide.
Okay. All right, sounds good. And then my last question is, our commission council had a bunch of questions, concerns, and I'm just wondering how that stands with everybody.
Through the chair to this honorable body, with regards to retroactivity, that's been mentioned. The other issue is being addressed. It's just a difference of opinion. We've actually, I think, resolved one other issue that was on your agenda that you probably didn't know for the same reason. I think we've resolved that, and we're working to resolve this one. So it's free to move forward, and all future contracts, I think we'll be fine with.
Okay, thank you. Thank you for that work. Thank you, Madam Chair.
All right, thank you. Since there's none other. All right, is there support? Supported by Anderson? All in favor?
Please vote using your tablets. Motion carried.
All right. Thank you. Next item, please.
Moving back to the agenda, F, such other matters as may be properly submitted before the committee.
There's none. Next item.
G, public comments.
All right. Is there anyone online that wishes to make a statement?
There are no hands raised on Zoom.
Anyone in the audience wish to make a statement? All right, hearing none. Next item.
Adjournment.
All right. Moved and supported, and